Then when we just subjected him to some routine cardiac investigations, we found he was in severe heart failure.
Oh my God.
His heart pumping was only 20%, meaning the heart was just flickering and contracting, which is, technically speaking, he could just collapse on the floor and die, and we could do nothing about it. That was the stage when he came. You see numbers like 250 by 140 blood pressure. There was once a figure where it was 280.
Oh my
and
God.
It was like, I told the patient, this is like a T20 score. Hypertension is known as the silent killer because it comes without symptoms. By the time you develop symptoms, that means the damage is already done. And you come and you're sitting here and you're saying that you're absolutely fine. No, you're not.
Hi, Dr. Das. We're very happy to have you with us here today. Welcome to Loop. I think I would first want to begin this conversation wherein I would want to ask you about your career trajectory, what got you into healthcare, why cardiology. I mean, out of all the specializations you could have chosen, you went for the most high stakes one. So what pulled you towards interventional cardiology and why healthcare?
Many years ago, when I was pursuing medicine, some of the fields that were really exciting, one was cardiology, neurology, surgery. Cardiology was very interesting. As like all fields of medicine now, but there was something about cardiology that instantly got you. One is there was such a mathematical method towards diagnosis. People who are really sick and you get the diagnosis right, you chart out the treatment and they respond so beautifully. So your results were seen very quickly. As you understood cardiology more, you realized how split-second decisions completely make the difference between life and death. It's so fast. A person who's dying, you take a decision and the person now lives. And that was very fascinating.
Yeah.
And I said, wow, I got to be a part of this. So I joined cardiology.
Today, I basically want to have this real, honest, no jargon conversation about hypertension and basically talk about something much bigger. And that is what modern work life is basically doing to people's heart health.
In simple terms, hypertension is high blood pressure. There is a textbook definition, roughly anything more than 140 systolic, which is the upper reading that you see, and more than 90 systolic is high blood pressure. There are classifications, and if your BP is even 130 by 80, you fall in the category of high normal or elevated BP. So different societies have guidelines. The Indian Society of Hypertension, they are more aligned with the European guidelines.
Okay.
So we generally follow the European guidelines. Those guidelines were based on evidence, based on the fact that if you meet these criteria, the likelihood of future problems is less. This is where modern lifestyle has actually influenced us so much, where all of us, I'm not so young, but individuals younger than me suffer from hypertension and their consequent adverse effects.
How often should someone be actually checking their blood pressure? Number one, and I'm very curious as to when was the last time you checked yours?
Okay, let's begin with the first part of the question as to how often. Look, now checking blood pressure is so easy. You have devices that are calibrated, available for commercial use. Pick it up and measure it.
Yeah.
And if the majority of your readings are above 130 systolic or above 80 systolic, that means you need medical attention. I mean, that's plain and simple.
Yeah.
Right? So we want to keep it well maintained. When did I check my last blood pressure? As early as or as late as yesterday. Because my lifestyle, my profession predisposes to certain factors where I actually became a hypertensive very early in life. Had it not been my profession and my knowledge of it, I would have ignored it.
Has there ever been a number on that monitor that got you really scared and not just clinically concerned for your patient?
And now I think nothing scares me because I've seen so much. But the youngest patient I have treated for hypertension is 12 years old.
Wow.
You see numbers like 250 by 140 blood pressure. There was once a figure where it was 280.
Oh my
and
God.
it was like, I told the patient, this is like a T20 score, cricket score.
Yeah.
And you come and you're sitting here and you're saying that you're absolutely fine. No, you're not. You know, I would have to admit you and treat you. Then when we just subjected him to some routine cardiac investigations, we found he was in severe heart failure.
Oh my God.
His heart pumping was only 20%, meaning the heart was just flickering and contracting, which is, technically speaking, he could just collapse on the floor and die, and we could do nothing about it. That was the stage when he came. Once you join the dots, you realize that he's only 18, but for the heart to reach the stage, how long must that high blood pressure have been there for? No human being likes to be told anything unpleasant.
True.
So if you're going to put a label of a disease on a human being, the first reaction is going to be to reject it. But that's a very, very difficult thing to digest for somebody who's never checked their blood pressure. I have a more worldly wise view of it. I educate the patient, I give them my best, and following advice is up to them.
Of course, it's up to their discretion. How often have you actually come across people who felt something was off in their body before you diagnosed them for hypertension? So, does the body actually give you any early signs?
So, always remember, hypertension is known as the silent killer because it comes without symptoms.
Okay.
Until and unless you check your blood pressure. By the time you develop symptoms, that means the damage is already done. Right? So if you're short of breath, that means there is end organ damage. Right? So that means the high blood pressure has affected the heart in a certain manner, which is causing you breathlessness.
Yeah.
If you're having headache or blurring of vision, that means the high blood pressure has affected your brain and your eyes, which is causing those symptoms. So never wait for symptoms. We cannot rely on symptoms for the diagnosis of high blood pressure. Check your blood pressure. That's how we'll know it. If you come with symptoms, that means you've been having high blood pressure for a very long time.
So, this particular fact is the fact that Indians are developing hypertension 20 years earlier than their Western counterparts. So, 20 years is a long time. And in your view, what's really driving that? Is it the genes? Is it the food? Is it our bosses? Is it the commute? Is it the 12-hour workday? What is it?
I primarily believe that this particular piece of statistic is not just true for hypertension, it's true for every other disease. Heart disease, diabetes, kidney disease. Indians fall prey to these illnesses much earlier than their Western counterparts.
Okay.
This change has been primarily driven by a very rapid shift in lifestyle, a rapid shift in dietary choices. The Western societies have had actually time to intervene. So our socio-cultural environments are very different. We've had to face the burden of poverty and infrastructural deficiencies and, cultural or socio-cultural issues, lack of employment for a far longer time than Western societies have had to face.
Yeah.
That's the trajectory of our history. And our lifestyles have changed very drastically. The younger generations falling prey to illnesses even faster at younger ages, right? So it is lifestyle driven, but it's not any one factor. There are multiple factors. Prosperity brings about a change in your lifestyle.
True.
Maybe your socio-cultural environments are such where, stress is a huge factor. It could be financial or otherwise, or whatever it is. But there are many, many factors at play and not just any single factor. Diet is, of course, one of them. We've made our shift from traditional dietary choices to Western dietary choices very fast.
Yes, we have.
Right? So junk foods become a part of a lifestyle. It's almost a given.
Yeah.
I mean, if you want to treat, what does a child ask for? A fast food, something sweet, something which When we were growing up, we didn't have easy access to it. I mean, it was there, but we didn't have easy access to it. But it's very easy. It's just a given. Today, at the tap of your finger, it's there at your doorstep.
Yes.
Right?
The preserved foods and the junk food that we go outside, that is something that we should not
So
consume.
there's a simple philosophy that I have. If food comes in a packet, avoid it.
Yeah.
Right? That's what I would recommend.
Yes.
But it's impossible to do so, right? You can't have it as a blanket rule. But if you use it as a rule of thumb, if food comes in a packet, avoid it.
Yeah.
You're probably on the safer side of things.
Yes,
Right?
for sure. At Loop, we recently launched our Workforce Health Index Report 2025. We basically examined 3,000 plus working professionals across India, and we got their health checked across various biomarkers. We also have the 2026 report underway, and the story it's telling is getting louder and louder. I want to draw your attention to one particular stat that we have in our report, that 44.7% of the workforce, which is nearly the half of the workforce, they feel, believe, and are of the opinion that their single biggest source of stress is work. It's not their family, it's not their finances, it's their work. And from you, I basically want to understand, is this the kind of pattern that you're seeing in your OPD clinics? Are you seeing a lot of corporate professionals walking in with blood pressure issues?
Very much so. Especially young professionals, and the patterns changed. When I started my career, we saw blood pressure issues in elderly people, usually above 45, 50. So let's not call them elderly, but we classify them as middle age. But when I was 25 and 26, 50 was older.
Yeah.
Right? So we saw high blood pressure in that age group.
Yeah.
Now, as I see today, like I told you, the youngest person I've treated for high blood pressure is 12 years old, right? So the whole pattern has shifted in a very short period of time. So when you mention the survey results and work being the source of stress, young corporate professionals very prone to hypertension. Yes. And I can understand, because you have corporate policies that are driven by result-oriented policies or goal-oriented policies, or whether there's enough free time or not. There's a lot of pressure on people to perform, whether they can meet their goals.
Yeah.
Okay, let me just compare my own life or my own profession. Tremendous amount of stress. I mean, maybe it doesn't show. For me, that's my work.
Yeah.
So I look at it that way.
Yeah.
But if I were to sit back and reflect that the result that I have to deliver is to safeguard someone's life and not to let that person die, or to be held responsible when someone dies, put somebody else in that situation, wouldn't that be stressful?
Of course it would be.
Hugely stressful,
Yeah.
right? Now, I may not be suited to sit in a corporate office and say, okay, you've got to reach this financial goal, or else it'll reflect in your salary or your incentive or something. Of course, that's very stressful.
Yes.
I mean, imagine you go to work and you have a sword hanging on your neck all the time. It's very stressful.
I want to understand, when you're going through all of that on a daily basis, what is actually happening inside the body, number one. And number two, what's the physiological chain that takes an individual from a stressful Monday morning to a cardiovascular event down the line?
Okay. So in biology, we have a situation or a response known as the fight or flight response.
Okay.
That is, whenever a human being or an animal perceives a threat to oneself, either that being fights to protect oneself or flees to protect oneself. Either way, the response is protective, but that involves a surge of adrenaline, quick thinking, immediate rectification of the dangerous situation. Adapt this particular situation to your day-to-day life. Stress. So two major chemicals that are secreted in your body, cortisol, adrenaline, they go up. If adrenaline levels go up, your heart beats faster, your vessels constrict, blood pressure goes up. Consequently, it leads to damage to all the end organs, brain, heart, kidney, etc. over a period of time.
Yes.
Because you're chronically exposed to what is something that is stressful.
Yes.
Cortisol is a stress hormone. Now, cortisol, high levels of cortisol all the time triggers different endocrine pathways, leads to reduced immunity, a gateway to illnesses, harmful effects on the cardiovascular system, and so on. So that is the biological explanation for stress. So tackling stress becomes very important. How else can I reduce the levels of adrenaline and cortisol, or the surges of adrenaline or cortisol over a period of time? That's where mindfulness, meditation, yoga, relaxation, sports activity, fitness, all of it comes into play.
Yeah.
One simple example I'll give is, if you were to rewind to your school days, what was stressful?
Oh yeah.
What was stressful was
100%.
your stressful was your academic performance, or the response to your academic performance at home or whatever. But what relieved the stress? My friends, going out to play, watching a movie. That meant so much, right? You don't do any of it right now.
Yes.
Yeah,
I
everything
think
is, yeah,
we should learn
because
from children in that sense.
absolutely,
Yes.
children are actually a textbook lesson on how to manage stress, and that's why it's such a joy to see them.
Yeah. Even pets, for that matter.
Yes.
Yeah. So I'm a Gen Z, and I know we are the people who seize the day. We are the people who came up with the idea of setting boundaries. We don't shy away from going to our managers and telling them we need a mental health day off. So we are very, we're upbeat about the mental health conversation. But the surprising fact, and that is something that our workforce health index report also sort of came up with, is that we're also the most stressed. And that's the biggest paradox ever. I want to first understand, are you seeing that same kind of pattern in your clinics?
Okay, so my greatest one single striking observation about Gen Zs is that they have a very limited capacity to handle adversity. If I were to contrast it with my own growing years, we were left to handle it on our own. So we handled it the best way that we could. We managed to, right? We hid it. Our parents maybe never got to know about it. I may have been bullied by somebody. They never got to know about it. I handled it on my own. But today it's not the case. I think it's not their fault. It's about the world that we've built for them, and how we have trained Gen Zs, or given the space for Gen Zs to handle such situations. As Gen Z, your needs are looked after, your comforts are looked after, because the parent feels so responsible for the younger generation. They want to give the best life possible. But I also think Gen Zs have been exposed to the lifestyle reset so much. We are the ones who've given fast food to them. We are the ones who've given screens to the Gen Zs. We are the ones who've made life so easy that they don't have to get up to even walk, exercise. Now exercise is a need. Exercise was built into our lifestyle. In my parents' generation, exercise was built into their way of life. People walked everywhere. People rode cycles. So it's how the world has shifted, and attitudes have changed, and lifestyle has been reset. So once again, I think lifestyle has a very important role to play, and Gen Zs are and the situations they face and the problems they face are an unfortunate byproduct of that. Right? This is not to say it's the fault of the Gen Zs. They've inherited it from us, or despite our most well-intentioned directions for the younger generation, this is how they've been molded into.
Now that we're coming to the end of this conversation, and we spoke so much about work stress, right? So I want to understand, what's that one piece of advice that you would want to give to the CEOs and CHROs out there? Because as I mentioned, a lot of working professionals say that work is their biggest source of stress.
Well, I think the CEOs and the CHROs are very well aware of policy level interventions that they set across the board for their employees. I'm sure they're aware that the well-being of the employees means it reflects in the well-being of the organization. The well-being of your employee reflects in the growth of your organization, right? So looking after your employee is of paramount importance. There are statutory guidelines that they are very well familiar with, and they implement it. But you do need to go beyond that. That's about promoting a culture. A culture of performance, yes, but it's got to be mixed with leisure. And it's
Yes.
got to be mixed with fitness. You got to be fit to meet the performance outcomes. You got to relax as well, so that your performance is always sustained at the best possible output. So fitness and leisure are two areas where I think need to be paid attention to. How to influence policy, I'll leave it to individual CHROs. But yeah, the broad perspective being that, look, your productivity and performance has got to be mixed with fitness goals and leisure goals.
Yeah.
That's going to be a very healthy mix.
Yeah.
And why I say this is because in my own personal sphere, the two things that I lack is the time for leisure. I understand I have to answer to so many people, so many patients. My time is not my own. I get pulled in all directions, and I find it extremely stressful.
Yeah.
But the one thing that keeps me sane is the time I put in for fitness, and sometimes when I make no compromises about my leisure time, right? And that I know how what it means to me. So I will definitely advocate that as a policy intervention in any sphere. The exact methodology, I leave it to the CHROs.
I think I just heard the part where the companies need to give their employees the space to just have fun.
Absolutely,
Yeah,
I completely agree. I mean,
I just want to have fun sometimes.
make your workplace
Yeah.
your playground.
Yeah.
Play hard.
If someone is watching this and if they could do just one thing to protect their blood pressure, we don't want to list just one thing, what would it be?
See, nobody really knows whether you're going to have high blood pressure or not.
Yes.
But the one intervention that will tell you when you need to act is to check your blood pressure. That's it. Look, there are many pieces of advice I can give. I can say stop smoking, stop alcohol consumption, don't have junk food, you run to work every day. But are they actually achievable on a large scale?
Yeah.
So, what then? You aspire to meet those goals. There's got to be a healthy balance. That's about it. But it all begins with first check your blood pressure. Check your blood pressure.
Yeah.
That's it.
It's very simple.